What is time-release medication?
Time-release technology is a mechanism used in pill tablets or capsules to dissolve a drug over time in order to be released slower and steadier into the bloodstream while having the advantage of being taken at less frequent intervals than immediate release formulations of the same drug.
So how do time-release pills work?
Time-release pills are designed to release a steady stream of a drug into your system over a certain period of time, instead of an instant hit of the drug in one go. This can be especially useful for continual suppression of unwanted symptoms of certain diseases or when painkillers need to be administered over a long length of time rather than the effects of the drug wearing off quickly.
The active ingredient is usually concealed in a web of insoluble substances, so that the dissolving substance has to find its way through the gaps in the web. Alternatively, the drug can be combined with other substances that once ingested swell up to form a gel with a near impenetrable outer coating, therefore releasing the active ingredient slowly. Some drugs will naturally dissolve slowly and therefore don't need to be embedded in other less soluble substances.
Today, most time-release drugs are formulated so that the active ingredient is embedded in a matrix of insoluble substances. Some acrylics, even chitin. These substances are often patented, such that the dissolving drug must find its way out through the holes in the matrix.
What is the difference between extended release and regular medication?
The active ingredients in regular medications are usually released within 15 to 30 minutes of when they are ingested. Often, they are prescribed to be taken 3 or 4 times a day. The active ingredients in extended release medications are released over a much longer period of time and are usually taken only once or twice a day.
The mechanisms by which extended-release medications are released into the body vary according to the medication. If you want to know more details about the specific mechanism used in a particular medication, ask your pharmacist. The important thing to know is that the medication is gradually released into your body so that it remains at a more constant level throughout the day. In the case of pain medications, this can be a good way to provide more consistent pain relief around the clock without the peaks and valleys often experienced when regular tablets are taken every 4 to 6 hours.
Why can't I cut extended release tablets in half if my pain is less some days?
Extended release medications should never be cut, chewed, crushed, or dissolved. In most cases, tampering with the tablet damages the mechanism by which the medication is released, and you could end up with an overdose because too much is released into your system at once.
What acronyms are used to indicate that a medication is in extended release form?
Several different acronyms may be used to indicate a medication is extended release. Here is a list of the most commonly used.
CA, continuous action or controlled action.
CR, constant release, continuous release, or controlled release.
CD, controlled delivery.
ER, extended release.
GR, gradual release.
LA, long-acting.
LL, long-lasting.
LTR, long-term release.
PR, programmed release, prolonged release, or protracted release.
PA, prolonged action.
RA, repeat action.
SA, slow acting.
SR, slow release, spaced release, or sustained release.
TR, timed release.
XR, extended release.
Which acronym is used is a decision left up by the drug manufacturers. There are no rules specifying the use of any specific acronym. In fact, some extended release medications don't use any acronym. For example, OxyContin is an extended release but has no acronym following it. So don't take for granted that your medication is not extended release just because you don't see any acronym in the name. But sure to read the information sheet your pharmacist gives you or ask your pharmacist if you have any doubts.
How much total medication is actually in an extended release tablet?
Whatever dosage is prescribed is the total amount contained in each tablet. A portion of that dosage will be released every few hours. Exactly how much and how often will depend on the specific medication. As an example, a 20 mg extended release tablet may contain two 10 mg dosage that are released approximately 6 hours apart.
When filling out forms that ask what medications you are taking, list the dosage exactly as shown on your prescription bottle. Your doctor will know whether or not it is extended release and what that means.